It's one of the most commonly used painkillers in the country, but the way you buy paracetamol could be about to change. The TGA is considering restricting the sale of the drug at places like your local supermarket.
We certainly don't want to take a sledgehammer to crack a nut to solve this problem.
It'll be very difficult if it went to prescription only.
I was running in my son's school's mother's race, and I tripped while running backwards. I ended up seeing a specialist who diagnosed me with dystonia, which is a neuromuscular condition, and it's basically muscles behaving very badly.
Leah's lived with chronic pain for 14 years, but this is the healthiest and happiest she says she's been in a long time.
How have you managed your chronic pain over the years?
So I started on codeine, but I also took morphine and tramadol and all kinds of different opioids over the years. Brain fog, jitters, sleepless nights, sweating. After a while, I got to a point where that was it. There was no more pain relief for me.
4 years ago, Leah switched to paracetamol, and she says that for her, the pain and her lifestyle have improved.
Life is just clearer. That's the biggest difference I have. I have a lot less pain, but the thought of having to lose my locus of control over this chronic condition that I've had for 14 years really just makes me feel kind of sick.
The Therapeutic Goods Administration is considering imposing restrictions on the sale of paracetamol because of the rate of injury and death from intentional overdose. A report commissioned by the TGA found paracetamol overdose is highest among adolescents and young adults, particularly females. In Australia, it leads to around 9 people per million hospitalised with liver injury and 2 deaths per million, or about 50 Australian lives lost, according to the TGA. The organisation's now considering a number of options, reducing packs to 16 tablets, limiting the purchase of paracetamol to 2 at a time, restricting access for those under 18, and making the medication prescription only.
This is not something you would usually do, is it? Stockpile?
No, there's no way I would do this normally.
So why have you done it this time? Are you
I'm
getting
nervous. I'm nervous.
Paracetamol is a relatively safe medication, safer than the non-steroidals, such as Nurofen. But of course, there's a small but significant problem of paracetamol overdoses, and we have to deal with that by looking at the causes of why people take overdoses, the mental health problems, and deal with that, rather than restrict access of paracetamol to all Australians.
GP Dr Robert Marr.
We really need to take into account the unintended consequences of restrictions that may really restrict access to a very useful medication for the 3 million Australians suffering from chronic pain.
Yeah, they're looking at changing the laws on these ones.
Pharmacist Syed Kodari believes changes could create more problems.
Looking around, you are busy enough as it is. Do you think this would cause more delays, longer wait times?
Well, yeah, it adds to the delay and the ease of access. And then I'm pretty sure the doctors are pretty full. We also run, multiple pharmacies in rural areas, and that's where they'll be hardest hit. And the elderly, paracetamol is one of the first lines of treatment for osteoarthritis, and nearly everyone has that.
What would it mean if Panadol Osteo was more difficult to get your hands on?
It means I've got to go to a doctor. It means I've got to take time out of my day. It's going to cost me money. It's just an added complication to a life of complex pain.
By taking paracetamol daily, Leah says she's been helped to keep a fit and active life. She kayaks, bushwalks, and she's even learning to surf. It's not the prognosis a doctor gave her more than a decade ago.
He told me that I would probably be housebound in 5 years, and he said that a lot of his patients were alcoholics and that I needed to watch the alcohol. And absolutely, there are days when I think to myself, I just want to make an appointment with that guy just to go, look at me now.
Can you appreciate that the TGA has good intentions? They're trying to solve another problem?
I do. I understand why the TGA is worried, and this is their job. This is exactly what they do. But I really think that the issue here is mental health and patient education.
Suicide is not only an issue amongst young women, it's also an issue amongst people living with chronic pain.
CEO of Pain Australia, Julia Jones.
I think that's really important for us, is that low-cost options are available to people, that they can buy a fortnight's supply even if they're on a low income and get on with their lives.
I took personal responsibility for my health and my pain management, and I don't understand why we are personally responsible for managing our health during a pandemic, but we can't be trusted to manage our Panadol intake.
If you or someone close to you needs help, there is support available. Contact Lifeline. The number is on your screen now. It's 131114. That's 131114.